The Respiratory Health Association is a proud supporter of the Whitney Reynolds Show, raising funds and awareness for lung disease research and programs. Additional support provided by Reach Out Community Center. Reach out and help one child at a time. You're watching The Whitney Reynolds Show. Dr. Robert Wolf is a diplomat member of the American Sleep and Breathing Academy. His dentistry practice focuses on treatment of sleep apnea, snoring, dental implants, and aesthetic restorative dentistry. Welcome to the show, Dr. Wolf.
Thank you for having me.
So it's not the sexiest title that we've ever said, sleep apnea.
That's correct.
But it really is a serious issue going on.
It's a very serious issue, and it affects so many people. I think that's one of the reasons it's so prevalent today.
So tell us a little bit about sleep apnea, because we're kicking off the show and people are kind of like, I'm hearing this more and more. What is sleep apnea?
Well, sleep apnea is a common disorder whereby there's pausing when you're sleeping. And these pauses or stoppage of breathing actually can last anywhere from a few times an hour up to maybe hundreds of times a night.
Is it the snoring? Does that mean you have sleep apnea?
No, not necessarily. A lot of people think if I snore, I have sleep apnea. That's not true, and studies will bear that out. But if you do have sleep apnea, you do snore.
What are some more signs to sleep apnea?
Well, things like high blood pressure, especially in the morning. If you wake up and you feel like your heart is just pumping and pumping, that's usually a sign that you may have sleep apnea. Other things that contribute, if you have diabetes, if you have heart disease, if you're overweight, acid reflux, and probably one of the other signs is the weariness or sleepiness during the day. A lot of people attribute that, I'm just stressed out, I didn't have enough caffeine, but that, generally speaking, is indicative of the fact that you just didn't sleep well that night before. It's fairly common for people to have some apneic moments during the night, during an hour. Anything under 5 times an hour is generally considered pretty normal. If you have more than 5, say between 6 and 15, that would be mild sleep apnea. From 17 to 30 times an hour would be moderate sleep apnea, and anything greater than like 30 or 31 times an hour is considered severe.
So should wives or husbands or significant others, if you hear someone quite often, that's maybe a warning sign?
Yeah, and what that is basically the tongue and the soft palate close off the throat, and you literally block off the airway, so it stops the flow of oxygen, and then all of a sudden the signal goes to the brain, hey, wake up, and so you wake up, and that prevents you from going into the REM sleep, which is the sleep where you have all the healing in your body. So that's why it's so potentially damaging to your health, because your body just doesn't get a chance to relax and to heal itself.
Right, and that's why you're saying you'd be very tired during the day because you never went into that REM sleep.
Right, and one of the biggest problems today is relating to any type of driving, or let's talk about pilots or train operators or taxi cab drivers, or even if you commute long distances to work, maybe early in the morning or late in the afternoon. I mean, I've had patients that literally fall asleep at a stoplight. So
you were talking about getting diagnosed, because you're a dentist,
right,
and you are really an advocate for sleep apnea. Are patients coming in wondering if they have it, or are you able to look and say, hey, I think you have sleep apnea?
Well, yeah, you can't just look at somebody and say, hey, you look like you have sleep apnea. But there are signs, and we generally do a screening. It's called an Epworth Sleepiness Scale Index, and basically what that is, just a questionnaire. You fill it out, and the way you score could be an indicator. It is an indicator of sleep apnea. So
you talked about weight loss and weight gain and how that affects sleep apnea. Explain that more.
Well, lack of sleep messes with the balance of the hormones in your body. And in particular, the two, ghrelin, and basically it's called the go hormone, or sometimes some people call it hunger hormone. So it's the one that says, hey, you need to eat, you need to eat, you need to eat. If you lack sleep, you have an excess of ghrelin. So it's continually telling you, hey, I want to eat. The other hormone that's keyed in this factor is leptin, and leptin is basically the thing that tells you to stop eating, like move away from the table, you're done, man. And so there's less leptin when you lack sleep. So more ghrelin, less leptin equals weight gain.
Okay.
It's very interesting because not a lot of people, there's not been a lot of emphasis on that, but it's really, really true because it can affect your ability to lose weight as well as just weight gain in general.
So what about those people that you meet that only sleep 3 hours a night?
There are those people, of course, we all know them, that can do that, and they can do that for years and everything's good. But for most people, you need about 8 hours of sleep a night. Wow. And generally speaking, people that have sleep apnea are overweight. Generally speaking.
Because they have the hormone.
They have that hormone imbalance.
Wow, that's something I never put 2 and 2 together. So lose weight, sleep more.
Yes, and you know what the interesting thing about the studies on this are that as little as 5 to 10% loss of body weight could have a profound effect on sleep apnea. And in fact, those same studies suggest that even 10 pounds could make a big difference.
So let's say you have sleep apnea and you lose 10 pounds. Can you ever conquer sleep apnea?
It has to be managed. There's not a cure. It's basically treatable, but not curable. And so it's a long-term management situation. And so you have to be cognizant of that. It's not like I can give you a pill or give you a shot and that's it.
But you can give us a retainer. Show us this appliance.
Sure. I brought this in, and basically this is the one that we use. It's called a Herbst appliance, and basically this is an adaptation of an orthodontic appliance, and it fits over the upper and lower teeth, and you can see it has kind of a piston-like device here. And basically it snaps in and it fits pretty tightly. And what the objective of this device is it basically shifts your jaw forward and holds it there. And these little pistons, you have little adjustments on here that we'll have you adjust those out to your kind of best sweet spot, as we call it. Okay. And basically it keeps you open slightly and forward slightly. So basically it's the same thing we do in CPR. What do? You tilt the head, pull the jaw forward, clear the airway.
How many people are affected by sleep apnea?
Oh, it depends on what you believe. Okay. I mean, 18 million diagnosed. It's estimated that maybe as many as 70 or 80 million people actually have it because the diagnosis rate is so hidden from us because it's usually masked as other things.
That's what I was going to say. It might be this number now, but the more awareness, like the show we're doing today, probably the more people are going to find out they have it.
I think you'd be shocked to know how many people already have it.
Well, thank you for coming on today.
Well, thank you for having me.
Well, it is now time for your social sizzle. I'm here with Roy Green. Now, everyone's like, Jetstream, Roy's in the house. How does it feel to be in Chicago?
I love it. Had an opportunity to visit with a great friend of mine. Everyone in Chicagoland knows Richard Dent, number 95. Dirty 95 is what I call him. So it's just good to be here.
That's awesome. Well, we're glad to have you here. And you're on the Social Sizzle, which is usually we're talking about Twitter, Facebook, YouTube, anything social online. But one thing I loved about you whenever we were working on this segment, you said, I don't do any of that. My social contact is face-to-face.
I like to interact. I love people. I love talking to people, communicating. So a friend of mine, well, let's call him acquaintance. I don't want people to know he's a friend. Oh. But Charles Barkley and I decided a long time ago we'd never do Twitter or Facebook. So.
Well, we have you on the Social Sizzle, and you're going to tell us how it is face-to-face day. So we're going to get social right here, face-to-face. So we have you on the Sleep Apnea show.
Right.
Tell us about your personal connection with it.
Well, obviously I have it, first and foremost, but a dear friend and teammate of mine had approached me about 2.5 years ago. I know that there's a certain look that people that have sleep apnea have, little circles on your eyes, looking tired, that kind of thing. And he said, I think you might need to go and get tested. And so I did, and in the interim, he told me he had just lost a brother from sleep apnea. He had it. He had started getting treated, and probably a few weeks after getting treated, his brother passed away from it. And it touched me deeply, because first and foremost, here's a dear friend of mine who lost his brother. And now that I knew that I had it, I just felt like there was things I needed to do to at least educate the public, to give them a choice or an opportunity to do something about it.
So we've said that today, that it's deadly, but I don't think people always think that it really is deadly. And you have a connection that was very deadly. A friend of yours lost his brother.
Oh, no question. I mean, and that's one of the satisfactions I get, because I know that what we're doing is actually saving people's lives. I mean, I get people that come up on the streets all the time, and they talk about, hey, I was at your last seminar where you talked about it, or I heard one of your commercials, and they talk about how it's changed their life, how much rested they are, how much active they've become, and it actually saved some relationships they've told me about, because how their husbands or their spouse had snored and they didn't even sleep together anymore, they didn't interact, but now they were. So a lot of good things are happening, but first and foremost is the fact that when you suffer from sleep apnea, it means that you are actually not breathing at night. And so when you're not breathing, not sleeping, that can lead to a multitude of other problems. So I'm happy that I'm able to get out and pass the word on.
So that friend that told you had the circles under your eyes, now that you know
I wanted to
you
punch
have,
him first.
Yeah, you wanted to punch him first, but you got over it.
Yeah.
And then now that you know you have it, what have you done to make sure to take care of yourself?
Well, I've had a great opportunity through that interaction to meet Dave Gergen, who's become a dear friend of mine. But he gave me the test, got the results back, and then I received the Hertz oral appliance. Yeah. It's something very simple. Football player, mouthpiece is just like, oh, this is simple.
This is normal.
Yeah,
this is a normal day.
Basically, you just put it in at nighttime when you sleep. It allows your passageway to open. You get a chance to breathe and get a great night of sleep. It's unbelievable, the difference in the way I feel.
Oh, wonderful. Well, thank you for coming on and getting social with us. We are going to have you back on with Dr. Gergen in just a minute. Dr. Todd Swick is a member of the American Sleep and Breathing Academy, an MD from Houston, Texas, here today to talk about drug use and sleep. Welcome to the show, Dr. Swick.
Thank you so much for having me, Whitney.
So we found out about sleep apnea from Dr. Wolf, but now we're kind of getting into the nitty-gritty about sleep apnea, how it's diagnosed.
The diagnosis is something that we have to look at in terms of how severe it is, what the symptoms are that accompany it, and the diagnosis involves actually observing a patient while they sleep and then measuring things like breathing, brain waves, eye movements, muscle activity. And when we do that during the entire night, we're able to see how many times an individual either stops breathing or develops shallow breaths that are associated with a drop in oxygen.
But football players, parents of football players with young kids in high school, muscles start to hurt. Sometimes people need painkillers.
There's no question that there's a place for it.
Okay.
What we have to guard against, particularly in professional sports, is the use of these opiates without real doctor supervision and for even perceived pain, not even real pain. In these cases, particularly in football players who tend to be bigger and who have a higher incidence of things like sleep apnea, the opiates will add to it and make it worse. Now, opiates are not the only painkillers that can cause medical problems. There's a whole class of drugs called non-steroidal anti-inflammatories, also called NSAIDs. And there is one in particular that's called ketorolac, which can cause kidney damage. And when you add that to things like sleep apnea, you develop vascular problems, high blood pressure, kidney failure, diabetes, lipid abnormalities. It's a cascade of medical problems that can be avoided with judicial use of medications, either NSAIDs or opiates, and watching people who are inherently heavier, linemen, for instance, in professional football, have almost a fourfold increase in heart disease and death because of they're told to bulk up, they're told that they need to be this immovable object against this irresistible force. So linemen are heavier, they have a higher incidence of sleep apnea, and they have a greater chance of developing things like high blood pressure, diabetes, heart disease, stroke, and kidney damage.
So if you are in a position where you're taking a painkiller, a high dose of it, you should definitely probably have the sleep test done.
If you snore, if you have excessive daytime sleepiness, if you find that you're waking up feeling as tired as you did when you went to sleep, these are all signs that you very well may have a sleep disorder such as obstructive apnea, and then you need to see your doctor.
And sleep apnea can be deadly.
There have been several deaths, including Reggie White, who died of sleep apnea, who was a professional football player.
Well, thank you so much for coming on. Anything else that I didn't ask you that you want to make sure to tell our viewers?
Sleep is something we all do. It's natural, but it can also be deadly if something goes awry. And if you think you've got a problem, ask your doctor to check it out.
Thank you so much for coming on.
My pleasure.
Our next three guests are raising awareness for sleep apnea. David Gergen is the owner of Gergen Orthodontic Lab and also the nation's leading manufacturer when it comes to sleep apnea appliances. We have returning guest Roy Green and Dr. Archie Roberts, both NFL alums and both advocates for foundations that support sleep apnea. Well, what a powerhouse of doctors, players, inventors that we have on this set. Oh my goodness. Welcome.
Thank you.
Thanks for having us.
Good to be here.
Yeah, I know everyone's come from all over, but let's talk about the appliance that you created.
Actually, I didn't create it. It's 100 years old. Dr. Herbst invented it. It's been modified. We did a Gergen twist on it.
Ooh.
Yeah.
Tell us about the Gergen twist.
I will. Well, we put integrated, here's the appliance. We put integrated framework through it, wire meshing. They don't break. It's the only appliance approved by the United States government. It's the Herbst appliance, and we're the leading manufacturer in the United States of this device.
We've been talking about the Herbst a couple of times today, so this is wonderful, and so you put your own little twist on it.
Works really well.
And it really does save lives.
Oh yeah, there's no two ways about it. This appliance will save people's lives.
How did you go about knowing that it needed to be developed even further than where it was?
Well, it was originally an orthodontic appliance, and then it got legs in sleep apnea, and we went ahead and thinned it out, got the acrylic super thin. It's very comfortable to wear. It fits very tightly, keeps them in a forward position. The mandible can't fall retrusive. It allows lateral movement, so synovial fluid will flow through the joints.
And people can really sleep in this.
Oh yeah, it's very comfortable.
So Roy, you have sleep apnea. We had you on earlier, and you were talking about kind of your connection with it. Do you wear that appliance?
Oh, yes, definitely.
Yeah, and you can sleep in it.
Sleep, talk, have a conversation. It's quite comfortable. I mean, when you first see it, you're a little worried about whether it's going to be uncomfortable or not. But, you know, I must say that sometimes, you know, if the fitting is not perfect, you can go back and have it reset or modified to fit. But yes, once it fits perfectly, there's no problems with it.
Now, Archie, you played football as well. You're quarterback, Miami Dolphins. Yeah.
And the Cleveland Browns.
And the Cleveland Browns. And that arm, I'm sure, is just as strong as ever. You still probably throw the football every day.
We talked about that. Tends to go into the ground now. Shoulder is not what it was.
And you are a doctor, you're a heart surgeon, and so you've gone beyond your years on the field. What's your connection to sleep apnea?
Well, sleep apnea and cardiovascular are connected at the hip. And a lot of the comorbidities associated with sleep apnea relate to cardiovascular disease. Cardiovascular comorbidities include heart attack, stroke, diabetes, sleep apnea. All of these are interrelated, and what we do working with the NFLPA and the player chapters all around the country is try to put some control and some study component into this whole program. In 2009, we did a study with Mayo Clinic looking at 239 consecutive retired NFL players like the two of us, but hopefully not as in bad shape as we are. No, I'm just kidding. But in that study, which was a formal look at tracking sleep apnea in retired players, we found that 60% of the linemen had sleep apnea, which is a very large, high number. So indeed, in this population of large-sized people, which football players are, sleep apnea and large body size are two of the critical issues that need to be addressed. And finally, working with Pro Player Health Alliance and Living Heart Foundation, we're able, working with the NFLPA, to put it all together and get into a treatment phase which will help these players live their lives in the best fashion.
So Roy, speaking of that, with being in the NFL and being a lot of the people that played with you guys, do you feel that it had anything to do with the painkillers that has caused sleep apnea as well? We had Dr. Swick speak to this earlier, but I want to hear, you know, a real life on the field example. Do you think it has any connection?
Well, in my opinion, yes. I mean, as Dr. Swick has said, there's information out there that says that in the era that I played in, it was common in order to get back on the field or to practice. You were giving anti-inflammatories, you were giving pain pills, different forms of opiates, you know, to play. I do believe that that's a part of it. I do believe that's a reason why such a large number of football players suffer from it. And as football players, we've been very blessed for what we do, had great support from people all around the country, and that's one of the reasons why we're not just limiting it to football players. That's why we're going into communities. We're letting, you know, moms, pops, their kids. We want everybody to know, because there's 50 to 70 million people that suffer from it that don't know. So we want to educate them and let them know that there's something that can be done about it. But first, they have to know that they have it. So testing is very important.
Testing is important and spreading awareness. Now, David, you actually tell us about the Pro Alliance. You mentioned it a little bit, Archie, but I want to hear all about it.
Okay. NFL put on this camp for teaching Pop Warner coaches to be better coaches. So I was the X and O coach guy on the field. The lineman coach was Derek Kennard. Derek's the guy that Roy was talking about earlier in this segment. Derek, I could tell, had horrible sleep apnea. Raccoon circles under his eyes. He was just like exhausted between rotations. And I said, Derek, you have terrible sleep apnea. And he said, yes, I do. And he says, I can't wear that mask. And I said, I'll get you a dental device. And in the process of making that dental device for Derek, his brother died in his sleep of sleep apnea. So Derek, I got him treated. He called me about a year later, maybe a year and a half, and he said, hey, Dave, we need to do something for my other brothers in the NFL, the former players. They all have it. Everybody has it. He goes, we got to do something. I said, okay, let me think about it. So I gave it some thought, and I said, let's do it. And I got a call from Roy. He says, Dave, I think I have it. I talked to Derek. I think I have sleep apnea. Got him treated, got him an appliance. Roy's been a big advocate. We've been helping people in communities. This is growing nationally. And now we're working with the NFL Players Association. Andre Collins, the director's supporting us big time. It's been working out really nicely.
With sleep apnea, it's interesting because it's all about getting it out there, letting people know that it can be deadly, and just spreading the word.
One of the great features that NFL players have, besides the aura of the NFL and the excitement of being part of that picture, but the individual athletes have a great knack at reaching out to the community and talking to them, and their health issues are the same health issues that the general population has. When the players talk heart to heart, the public is all over it. And the combination of the doctors a bit and the players is hard to beat.
Oh, well, it has been wonderful to have all of you on the set today. Any last words from you, Roy?
Well, I think that I just want to sum up a little bit of what the doctor said, and that is part of it. I mean, as I said earlier, so we've been so blessed, so privileged to play what I think is the greatest game in the world, and the support that we receive all over the country, and for us to be able to come back and, as the doctor said, to interact face-to-face in seminars, to shake a guy's hand, to talk to a mother or, you know, a husband, whomever, about what's going on and that you're going through the same thing and that you've dealt with it, you overcome it, and they can do it too, is just an outstanding feeling.
Well, thank you all for coming on.
Thank you.
For more information on today's show or ways to get involved or to find out more about sleep apnea, make sure to visit WhitneyReynolds.com. The Respiratory Health Association is a proud supporter of The Whitney Reynolds Show, raising funds and awareness for lung disease research and programs. Additional support provided by Reach Out Community Center. Reach out and help one child at a time.